called nursing hub. It is very, very important to acknowledge the impact the nursing hub is making. I'm shooting live from one of the great areas in this country. But the most important is to know the importance of nursing hub, and that's why practically I'm here trying to show you that the nursing hub is very, very fundamental. So it is across, or it is a good area for us to be able to know what is happening into the world of nursing and midwifery. Yeah, so for everyone, for people who are looking at what we call nursing hub, this is one of the important channels that are going to champion what we call nursing and midwifery related knowledge. So I want you to feel at home. Of course, the way we are going to be empowering ourselves as the nurses and midwives of this generation. So I'm going to be sharing with some of the items that so the nursing hub is a well-built channel that is more importantly good for us to use. We have a very nice website that is good for the people, most especially when we talk about using it for the best of our generation. Most also, we want to say that as you look at it, it's very, very important to notice that we have a full working, or what we may say, a fully working layout for most of the information that we desire. So you can see we have a nice layout about what I may call the nursing hub. We have lectures there. Exams are going to be happening there. CPDs are going to be happening. We have resources that we shall be sharing with you. And of course, everything's about how we control or how we shall regulate, of course, has premium and then the community. So it is one of the families that you don't need to fail to have under your docket, most especially learning through it. So I have, for example, here on the resources, you can see we shall be putting study notes and lectures. Then on the CPDs, as you can see, there are many CPD programs, and these CPD programs are important even for the young people, the nursing students and midwives in making. And then, of course, even those who are already qualified, they do deserve these nursing rated CPDs. So it is very, very helpful that you will learn from them and you will know their impact in our society. Of course, we shall be putting some lectures and other kind of related exam scenarios for helping students to learn. This is going to be championing one of the best, if I may say, one of the best learning platforms in this country, Uganda. So I want to welcome you. I'm the founder with a lot of bright brains around it, but I want to take you to my welcoming message, and then we shall look at the mission and the vision. Yeah, so I'm saying that hello and welcome. As me, myself, I'm a health tutor and a nurse practitioner. Of course, who has been deeply involved in all the nursing education. I've worked at the same path you are on as students. And I know the weight of the textbooks and the pressure of the clinical rotations. And of course, the burning desire to provide the best possible care for your patients. So I founded this nursing hub together with a team of dedicated students. And I believe that every student, whether you are starting or the certificate or advancing, so diploma or pursuing even bachelor's, you actually deserve more than just a syllabus. You need a roadmap, and this is who we are as the nursing hub. So in this fast-paced world of healthcare, of course, here is our foundation, but experience is our compass. And our motto, as you can see, is that experience offers direction. And we are saying this is just more than a phrase, and it is our promise to you. So we are here to bridge the gap between classroom and bedside, and actually transforming the complex concepts into practical and life-saving competencies. So whether you are here to master these intricacies of medical surgical nursing, or you are here to refine your midwifery skills, or prepare you for the final examination, you are now part of us as a dedicated community to help you excel. So let's lead the way in transforming healthcare, and of course, one student at a time. And it's our mandate. So those are my names. I'm Andrew here. And of course, I'm also a scholar in what we call infectious diseases. So I want to say that at Nursing Hub, we are glad. Of course, we have a very fully published standard AI together with which has been incorporated into our work. And you can see this tab. We have a tab which we call Ask Nursing Hub AI. And this Ask Nursing Hub AI is very helpful. Of course, as you click on it, you'll find that it has a variety of information for you to actually enjoy. So it has its search button or search tab where you will type in whatever you need below there, and you can enjoy. Of course, we have a research tool, as you can see, which is equipped with a variety of information for your research guidance. And of course, we also have what we can call generate research outline. Here you put your topic on, and you sit as you enjoy us take you through each and everything. So that is very, very important. Then also we have a literature laboratory, and this is very, very important for us to enjoy what we call literature review. Of course, we have cross-referenced, PubMed, we have citations, you choose whatever you want, and you can choose the studies from every area, whether global, Africa, Uganda, low-income countries, and other high-income countries. So it is very, very important, and you can put the count of what you may desire to have. And then, of course, when you look at all that piece of work, of course, I'm not working. Here you come and put your topic, and when you put your topic, of course, it can take you. Then, of course, as you do search, these are some of the things I was searching before coming to live here, is that when you look at this search, you can really tell that, for example, if you search anything, you will see that the way it comes, it gives us a lot of information, most especially putting in citations that can help you if you want to read ahead. For example, here I was just asking about a list. You see, it is just this research, and it's giving us a variety of information. But let me say, if you want to do like a drug calculation, and it is helping you to look at it, that means you can easily check something of that kind. Then, of course, as we move, We shall always give you what we call weekly newsletters. Weekly newsletters. If you scroll, we have this jump section. You can go to our weekly newsletter. And our weekly newsletters, of course, give you health-related information. So students are going to be actually giving us, even as scholars, and we help to have our publication. This is very helpful, and I'm calling upon each person to really subscribe and be part of this fast learning world.